In 2000, yes, 20 some years ago, the Drug Addiction Treatment Act was passed where the DEA required doctors to apply for something called the X-Waiver. And this allowed them to prescribe medication for addiction treatment like buprenorphine. It was called the X-Waiver because the license number started with X. The goal of this law was to allow doctors to increase access to medications for opioid use disorder. Before this law, before Data 2000, a doctor could only prescribe buprenorphine to patients at these places called OTPs, or federally certified opioid treatment programs. So in effect, the Data 2000 law waived, hence X-Waiver, waived doctors from these OTP regulations and allowed them to prescribe buprenorphine to patients as long as they met certain requirements like holding a current DEA registration number and completing this additional 8-hour training program. And this training program was supposed to increase awareness of opioid use disorder and increase doctors' abilities to provide different kinds of treatment for opioid addiction, like buprenorphine. The general consensus of policy experts and activists that the X waiver has actually made it really hard for people in rural areas and people of color to access buprenorphine in the midst of the opioid crisis. And I've personally seen this as a primary care doctor, as an addiction specialist who's worked in a lot of different settings treating addiction. And to this day, if you're to look at who has access to Suboxone in an office setting versus who has to go to an OTP methadone clinic, there's a racial and class disparity. Thankfully, in 2016, the CARA Act, or CARA Act, Comprehensive Addiction and Recovery Act, expanded the Data 2000 law by allowing nurse practitioners, NPs, and physician assistants, PAs, to get the DEA waiver to prescribe buprenorphine. But they also had to complete this 24-hour long training. And this is why awesome colleagues like yourself, Micah, are able to take care of so many people in this way, right? In 2018, there was the Support Act, which further expanded the Data 2000 law by allowing nurse specialists, nurse anesthetists, nurse midwives to also get the DEA X waiver. In December 29, 2022, President Biden approved the elimination of the Data X waiver requirement completely. So this means any prescriber who has a standard DEA registration number can prescribe buprenorphine, including Suboxone. This also removed the limits on patient caps on the number of patients a prescriber could treat with buprenorphine. And actually, when the Data 2000 law was passed, there was a limit. A doctor could only take care of 100 patients with buprenorphine. And then this was expanded to 275 patients under the Obama administration. And now Biden has completely removed this, and there is no more limit.